Top story tonight at 6, health advocates, medical experts, and users of medical cannabis speaking out today in support of expanding Georgia's low THC medical cannabis program. 41 NBC's Taylor Gilchrist reports.
Advocates for Georgia's medical cannabis program say the state's restrictions on medical marijuana and hemp prevent thousands of Georgians with chronic conditions from getting the help they need.
Allowing me to only have THC and CBD is like saying I can have spaghetti noodles without sauce. That doesn't work together.
On Thursday, a host of speakers came before state lawmakers at Mercer University, making the case that Georgia's medical cannabis laws are outdated. One of those speakers was Judson Hill. He's the Georgia market president for Feinfettel, one of just 3 state licensed medical cannabis dispensaries, and operates in Macon.
We're trying to catch Georgia up, offer better treatment through more expansive products, and opening up the conditions so that more Georgians are aware that they could use medical cannabis for their various ailments.
According to the Georgia Department of Public Health, roughly 30,000 Georgians are medical cannabis program patients. But many argue that number is far too low as restrictions limit qualifying medical conditions. That's why the Georgia House of Representatives Blue Ribbon Study Committee on Georgia's medical marijuana and hemp policies is traveling across the state to hear from advocates of program expansion. State Representative Dr. Mark Newton serves as committee chairman. He agrees medical cannabis access should be expanded, but says it must be done so in a manner that protects Georgia's youth.
We want to make sure we've got the right conditions, the right recommendations, the right medical input for a patient who needs this for they or their family member's condition.
A law called the HOPE Act requires patients in Georgia's low THC medical cannabis program to have terminal conditions and get their products from state licensed dispensaries. It also requires patients to use non-smokable products such as edibles or topical lotions, as opposed to inhalable form factors advocates say provide immediate treatment. Hill says the state must evolve on its perception of cannabis to unlock its full public health potential.
It's driven patients either to other states or to the traditional market where we have safe, legal, tested cannabis grown right here in Macon, and we're just trying to let the people know that that's an option for them.
In Macon, Taylor Gilchrist, 41 NBC News.
The state House and Senate versions of medical cannabis expansion both failed during the 2025 session. Committee members say input will help them make recommendations in 2026.